Thank you, Mr. President. And Senators, House Concurrent Resolution 57 commends and congratulates Idaho State University for its outstanding educational, clinical, and research programs in the health professions. In order to support and enhance these degree-granting programs, Idaho State University has developed a system of 15 healthcare clinics throughout the state. And these clinics provide experience for its students while offering healthcare services to Idaho communities. To illustrate my point, let me focus your attention on the Meridian clinics. There are 3 ISU health clinics in Meridian: speech pathology and audiology dealing with cochlear implants, brain trauma, and stroke victims; the counseling clinic in mental health; and the advanced family dental residency, where last year alone, between the Meridian and the Pocatello clinics, they accommodated over 7,000 patient visits. These were serving the underserved that have no dental insurance, those with high deductibles, and the very poor. Another clinic that I would like to mention is the Pocatello Family Medicine Clinic, which is located on ISU's main campus in Pocatello. It is a clinic where graduates from medical school come to further their education through a 3-year-long residency in family medicine. This clinic has 1 operation room, 17 exam rooms, and offers a full array of medical services. While ISU's clinics are an obvious benefit to individual Idahoans, they also provide a rich educational experience for students. Pre-med students get primary care, clinical exposure to add to their resumes. Nursing and physician assistant students gain valuable experience treating patients, and pharmacy students benefit by providing outpatient services to clinic patrons. Another facet of ISU's role and mission is biomedical and healthcare-related research. Recently, ISU received approximately $32 million from non-state sources. Those grants funded research in the areas of diabetes research, prosthetics development, cardiovascular health, and cancer treatment. So please join me in voting to commend and congratulate Idaho State University for its outstanding programs in the health professions and the positive impact that those programs make on the quality of life for the citizens of Idaho.
Several years ago, I had the opportunity to sit on a screening committee when Idaho State University was in search for a new president. And one thing that I didn't hear the senator from 29 mention was the fact that we have a wonderful and qualified president of Idaho State University, Arthur Velas, who has come and was hired to do exactly what has been happening at Idaho State University. When he came, he had a vast amount of experience working at the medical schools at the University of Wisconsin and at the University of Houston and at UCLA and other facilities around our country. And with his expertise and experience and background, he is doing what I think could be considered to be miraculous things at Idaho State University, as he is bringing them to a new level in the health professions and encouraging them to expand and broaden. Not too far from us here in Meridian, and I hope that all of you have perhaps had a chance to go out and visit the ISU Center in Meridian and see the things that are happening there. This past Wednesday night, I was in a meeting and reference was made to the quality of the programs that Idaho State University has implemented. And I think the statement was said that the pharmacy school at Idaho State University, which is one of the oldest professional training facilities that we have in our state, is among the world's best in training young pharmacy students. I think that I can fully support the effort of this concurrent resolution, not only to recognize Idaho State University for what they have done in the past and what they are currently doing, but certainly to offer the legislature's encouragement to continue to improve and look for opportunities to expand. We know that we have great need for medical professionals in our state. We're among the lowest in our nation as per capita of doctors relative to our population. And President Velas and others are working hard to get Idaho into a position where hopefully at some point in the near future we can perhaps initiate a medical school in our state so that we don't have to export our students into other states' programs where they have to compete to find a place where they can receive the training and pursue the professions that they are desirous of entering into. So, Senators, although this year, perhaps with our budget situation that we're facing, is not a good time to perhaps pursue this to the degree that we should, but hopefully in the near future, as our economy improves, we can keep that as a priority for our state, as something that our state needs to keep an eye singled to so that we can, when possible, ensure that the citizens of our state are provided with health professionals that can care for their needs not only now but long into the future. Senators, I would hope that you would unanimously support House Concurrent Resolution number 67. Thank you, Mr. President.
Thank you, Mr. President. I would be remiss if I didn't stand up and just offer my congratulations and commend the good senator from 29 for bringing this concurrent resolution forward and all the information that the ISU provides in the way of health-related profession. And I certainly can't add any more than the good senator from 31. So my comments are going to be very, very brief. I just want to I know I've had these conversations with many of you about the mission of Idaho State University in the way of health professions. And I know that I've received a lot of encouragement. And I just want to let everyone in this chamber know how much I appreciate that support and the words of encouragement to continue the efforts that Idaho State University has had in this mission of the health-related profession. When I listen to the details of what Idaho State University offers, it's just overwhelming when I listen to the good senator from 29 describe all the different programs. And I realize that we really don't do a very good job in advertising and really selling the health-related professions at Idaho State University. And I think we need to do a better job of doing that. I can't imagine that after you hear of all what Idaho State University is doing, that we would not support that effort in continuing to expand healthcare in this state that we so desperately need, especially in our rural areas around the state. So I look forward to continue to work with all of you, continue to work with the State Board of Education and many others that have a key role and influence in the decision-making process of how we can make that better. So I urge your support as well. Thank you, Mr. President.
Thank you. Further debate? Hearing no further debate, Senator Bilyeu is recognized to close debate on House Concurrent Resolution 57.
Thank you, Mr. President, and I thank Senator Geddes and Malapai also for your additional information and debate. And with that, Mr. President, debate is closed.
Debate being closed. Question is, shall House Concurrent Resolution number 57 pass the Senate? All in favor say aye. Aye. All opposed, nay. The ayes have it, and the resolution is passed. The resolution will be returned